Today I'm going to be giving an insulin injection. The first thing I'm going to do is check the doctor's orders, verify the type of insulin prescribed, the amount, the frequency, and the hospital's sliding scale protocol. The sliding scale, basically, you're going to check the patient's glucose levels, and based on what their glucose is, you're going to compare it to that sliding scale, and whatever range theirs falls in, it'll tell you how many units you're needing to give. I'm going to check the MAR 3 different times during this process, when I'm getting the vial out of storage, when I'm preparing the insulin, and before I put it back in storage. I'm also going to check the expiration dates on the insulin, and then I'm going to take it into the patient's room. I'm going to explain that he's getting an insulin injection for his glucose, check his allergies, and wash my hands. Now I'm going to prepare the insulin. I'm going to clean both of the vials. Okay, this is an insulin syringe. You can tell because it's in units, and it also has the orange cap, which most insulin syringes have. First thing I'm going to do is draw up the amount of air that I'm going to be injecting. For instance, if I was going to get 10 out of this, I would just draw up 10 units of air, inject that into the cloudy, pull it out, and we'll say that I'm giving another 10 of regular, so I'm going to draw up another 10 units, inject it into the regular. I'm going to tip this over and draw out the 10 units. Okay. Now I'm going to have another nurse with me. She's going to verify that I drew up the 10 units of the regular insulin, and if we have badges and we're using the CMAR, she can scan her badge too. Then I'm going to inject it back into the cloudy and draw up the rest of the 10 units. Pull that out. She's going to verify that I drew out 10 units of the cloudy insulin and that the total equals the right amount that I'm supposed to be giving. Then I'm going to recap this without touching the table. Okay, now this is a sub-Q injection, so I'm going to, there's 5 spots. It's going to be back of upper outer arm, 2 inches from the belly button, the left handle, the upper outer thigh, and the top of the glute. It's important to remember that the antidote is dextrose, and before you give this, you want to make sure that their blood glucose is not already low. If you're going to be giving insulin, it's going to drop it even more, and they could become hypoglycemic. Signs and symptoms of hypoglycemia: thirst, sweating, confusion, and dry mouth. I don't want to actually inject this. Okay, sub-Q injection, you're just going to pinch up this inch fat fold, go at a 45 to 90 degree angle, dart-like motion, and inject it. Take it out. Take both of these, throw them in the sharps container. Okay. Then I'm going to document the blood glucose before I gave the insulin. He tolerated it well, and I checked with another nurse. And that's an insulin injection.